Hi, my name is Jenny Smith. This is for Oral Communications with Professor Haynes. The topic I'm going to discuss with you today is about communication breakdown in the medical field, involving medical errors such as with patient care and things like that. This topic is very important to me. I have been a nurse since 2007, and I mainly do in-home pediatric nursing, which involves all kinds of different ways that there can be errors. Believe me, we can do anything from receiving documentation from the doctor via phone. It can be written down wrong, or just reading somebody else's notes, their nurse's notes, or transcribing a medication wrong. We call in medications over the phone. So personally in my life, I have been involved with situations in where there could be big medical errors. You just have to make sure that you read everything, and if things don't sound correct to you, then you try to fix that. Anyway, we'll get back on my own personal feelings about it later. Right now, I'm going to tell you a few statistics about medical errors that I thought were kind of crazy. Would you believe that medical field errors occur for 44,000 to 98,000 deaths per year in the U.S.? This is just medical errors. This is not car accidents. This is not cancer. This is not, anything like that. This is strictly errors made by people that control machines, made by people that are given wrong medicines, made by people in general. People. To me, this statistic doesn't even need to exist, let alone be as high as it is. It's insane. I've personally seen how medication errors can affect patients. I've had breakdowns between doctors and rehab facilities, and had medicines totally get canceled for patients that they needed on a daily basis. The numbers are undeniably startling. They suggest that more Americans are killed in United States hospitals every 6 months than died in the entire Vietnam War. And some people have actually compared the alleged rate to 3 fully loaded jumbo jets crashing every other day. Widely disseminated quotes include medical mistakes kill 180 people a year in U.S. hospitals. This is a statistic that does not need to be so high, let alone, like I said earlier, exist at all. A 2006 study found that medication errors are among the most common mistakes made around by people, made by pharmacists, made by nurses, doctors, etc. These mistakes harm at least 1.5 million people every year. According to the study, 400,000 preventable drug-related injuries occur every year in the hospital. That means 400,000 things have gone wrong that could have been prevented if people were just more careful. 800,000 have occurred in long-term care facilities such as nursing homes that could have been prevented, and roughly 530,000 among Medicare recipients in outpatient clinics such as doctor's offices, clinics, that kind of thing. According to a 2002 Agency for Healthcare Research and Quality report, about 7,000 people were estimated to die each year from medication errors. About 16% more deaths than the number attributed to work-related injuries, which was 6,000. This is such a large number that can be decreased so easily if people would just communicate better between each other. If the handwriting was more legible, if things were documented on computers instead of on paper so much, that way you wouldn't have to read or transcribe as much done with just handwriting. I've read many different stories that vary from errors including implants being placed in the wrong patient, to errors that result in death, blindness, you name it. There have been all kinds of things that have happened to people resulting from medical errors. Just the sheer number of people that have been injured or disabled permanently due to negligence of others is overwhelming. Most errors result from problems created by today's complex health system, but errors also happen Errors also happen when doctors and their patients have problems communicating, Some mistakes include medication errors, such as a patient receiving the wrong drug, receiving the wrong dosage of a drug, surgical errors, such as amputating the wrong limb, believe it or not, that has been known to happen, diagnostic errors, such as misdiagnosing a disease, leading to an incorrect choice of therapy or a medication, misinterpretation of test results, resulting in people thinking they have cancer or diseases when they don't. The list goes on and on. I mean, there's so many different medication or medical errors that occur, not just medication errors. I mean, it's just overwhelming. A recent study supported by the Agency for Healthcare Research and Quality found that doctors often do not help their patients make informed decisions. Uninvolved and uninformed patients are less likely to accept the doctor's choice of treatment and less likely to do what they need to do to make the treatment work. These and other medication errors reported to the FDA may stem from poor communication, misinterpreted handwriting, drug name confusion, lack of employee knowledge, and lack of patient understanding. Boston's Children's Hospital was listed in the top 3 in 8 fields for best children's hospitals. So you would want to assume that taking your child to this hospital, there would be no errors. There would be no room for errors. Well, like I said, it ranked at the top 3 more than any other children's hospital. However, that has not stopped them being in the headlines. A jury awarded a couple $15 million for the death of their son after he received treatment for a neurological condition. One of the doctors that worked on the child was a former physician-in-chief at Boston Johns Hopkins Hospital. In June 2012, a worker awarded $55 million to the parents of a young boy who is now living with cerebral palsy. The jury found Johns Hopkins guilty of malpractice after waiting more than 2 hours to perform an emergency C-section on the pregnant woman. The delay in delivering the child is thought to have caused the brain injury, leading to her son's condition. The boy, now 2.5 years of age, has severe brain injuries and can only function at the level of a newborn baby. I write this information not to point fingers, but just to make you aware that this happens everywhere. People are human. People make mistakes, and that's all you have to take care of you are people. Don't think for a second that just because you go to a better hospital means that things won't happen to you, because they will. I'm not saying that they will, but there's a possibility that they could. Let me correct myself. There's a possibility that they could. Some of the things that can be done to prevent errors like this are physicians can type up their orders instead of handwriting things. That way there's no confusion in what's written down and what's not. Things such as prescriptions that could easily cause death that can cause death if prescribed wrong can be double checked by another physician or another nurse or somebody else to make sure the dosage is correct. Just the possibilities are endless on how these simple, easy things can be fixed, and less death, less patient trauma, less family trauma. All these things can be avoided if we would just try to communicate better between one another instead of having such a hierarchy about doctors are high and mighty and the nurses are low on the totem pole, and it goes down like that. Everybody needs to work together for better patient communication and better patient care with everybody, and there would be less problems like this. This concludes my speech. Thank you for your time. I appreciate it.